Okay, today I'm going to show you a few exercises to do with the foam roller, which is a fantastic piece of kit. You can get one of these for about £10 on the internet. You can get a sort of half-length one as well if you haven't got much space to store it. Or you can use Rumble Roller, which is a little bit more of an evil tool. See these little nodules here? They're particularly good for getting into the muscles. Today we're going to be doing mostly lower body, so legs, because it's mostly for runners, this sequence. So great thing to do early in the morning. I like to use a timer, like the Gym Boss, my lovely pink one here, and you can set it up to go for 30 seconds and then have a 10-second sort of interval when you switch from one exercise to another. So I recommend that one, or you can just use your iPhone or whatever. So let's start off with this roller here. First exercise is working the tibialis anterior. So this is the opposing muscle to the calf, and because the calves get very tight when you're running, the opposing muscle also will tend to get quite tight. So if you're having sort of shin splint type pain, or if your calves are just generally feeling quite tight, get onto the tibialis anterior, and this is how you do it. So you want to support yourself here on the ground, and you're just putting a little bit of pressure there into the foam roller. You want to go reasonably slow, and for me I need to put a bit more pressure into that. So it's just starting to get some blood flow going. If I do feel some particularly tight areas, I'm just going to hold on it there, take a few breaths, and just kind of let the muscle release, and then kind of keep going. I can feel some blood flowing into there now. So that's tibialis anterior. Of course, do the same on the other leg as well. Next up, calf. This is how you set up for the calf. You can start off with both legs on the roller if they're a little bit tender. For me, I just put a little bit more pressure down into that calf muscle. You need to remember to relax. It's quite a difficult one, but if you imagine you're going for a massage and you're tensing all your muscles up, you're not really going to get much benefit from it. So you really want to relax and just breathe. Go nice and slow. You're searching for a sore spot. We've got one there. I'm just going to maybe turn the foot a few times just to get the calf muscle kind of firing up and relaxing, and then just really let it relax and try and get to the deeper level of the muscle, and again that'll increase the blood flow into that area. So that's your calf roll. Next we're going to go to quads on the front of the legs. This is how you set up for that. Let's start with both quads at the start, and then move to the individual quads. So you come into a plank position, and again relaxing the muscles on the front of the legs. So starting just above the knee, and I'm going to roll all the way up to the hip if you can. And nice and quick back to the knee, and then a slow roll all the way up. Again, it's just massaging those quad muscles. So once you've gone both quads, you probably want to switch to single quad, which looks like this. So more on the sort of lateral side of the quad. So more this kind of, you don't want to go right on the side, which is the ITB. It doesn't really respond that well to rolling. It's the quads that respond to rolling. So you want to get kind of this diagonal pattern here. And again, trying to find a sore spot of the muscle and just slowly working my way up towards the hip. This left leg here is just kind of keeping me balanced. And again, nice and quick to the knee, and then controlling. And really, this is a tough one to stay sort of relaxed on. So do your breath to just sort of breathe and take a Zen moment. So once I've done that, final one now, I'm going to actually come up higher up onto the hip. So I'm actually in this kind of region here, and it does tend to get very tight from running because the single leg needs to stabilize as it impacts the ground, and then it's the hip which kind of holds you in that upright position. So tied the hips do tend to get very tight, and it can be also a cause of something that you call ITB syndrome, where you actually feel the pain here, but often the cause is more sort of up here. So just rolling in here. Can be a bit difficult to get into this on a roller. Sometimes you might need to use a hockey ball. But just kind of going back and forth, searching for a tight spot again. You can even go onto the glute, the bum muscle, there. And that's actually working quite well for me. So 30 seconds on each of those. Obviously you want to go on each side to balance the body out. Good luck.